Hello, and thank you for joining our presentation for this poster for ERS Congress 2024. Our poster is a breathomics database to identify, contextualize, and validate biomarkers of respiratory conditions. Volatile organic compounds, or VOCs, found in exhaled breath can offer a promising route to safe, non-invasive diagnostics in multiple disease settings. Many breath-based studies have been carried out in respiratory diseases, but there are few validated breath-based biomarkers currently in clinical use. Fractional exhaled nitric oxide breath tests measure exhaled nitric oxide as a biomarker of airway inflammation for the assessment of asthma and are currently used in the clinic. However, there is a need for better biomarkers to improve the accuracy of this test, as well as additional breath tests for a wider number of respiratory conditions. The complex and unknown composition of the breath matrix makes the identification and validation of on-breath VOC biomarkers a significant challenge. Therefore, we are developing the Breath Biopsy VOC Atlas to provide a comprehensive catalogue of VOCs identified in exhaled human breath. This atlas can be used to support the development of breath VOC biomarkers and diagnostics. In this study, 94 adult volunteers provided breath samples using Alstone Medical's Breath Biopsy Omni sample collection and analysis platform. A paired equipment blank sample was generated by sampling room air immediately before each breath sample collection to compare with breath samples to distinguish VOCs originating from the background and those truly present in breath samples, also known as on-breath VOCs. Samples were analysed using thermal deabsorption gas chromatography mass spectrometry, or TGGC-MS. Molecular features were determined to be originating from breath using 3 analytical metrics. In total, 1,471 features were identified in the breath samples, and 328 of these were classified as on-breath by our 3 analytical metrics. Currently, more than 180 on-breath VOCs have been identified using comparisons to purified chemical standards and have been added to the Breath Biopsy VOC Atlas. These compounds include aldehydes, alkenes, alkanes, alcohols, carboxylic acids, and many more. These categories will expand as additional VOCs are added to the atlas. Lipid peroxidation is a major origin of VOCs in the breath of those with respiratory conditions. Chronic inflammation triggers this process and the subsequent release of VOCs such as alkanes, aldehydes, and hydrocarbons. Many hypothesized liquid peroxidation products are found in the VOC atlas. Acetone is one of the most abundant VOCs in breath and is found in the atlas. Acetone can be produced via the fatty acid beta oxidation pathway. During acute lung injury, inflammation can lead to metabolic reprogramming, such as impaired fatty acid oxidation. This can alter the composition of VOCs seen in the breath and therefore be an indicator of disease. The results of this study highlight the power of the VOC Atlas and what it could bring to respiratory research. The Atlas can support future breath studies by providing reference ranges of on-breath VOCs in various cohorts, including disease and healthy populations, alongside insight and scientific context to identify compounds to enable the confident selection of candidate biomarkers. Thank you for listening to our presentation and hearing more about our poster today.